Welcome to the show. I'm your host, Dr. Joseph Coppus, and I'm joined by my guest, Dr. Lizzie McNally of Brunswick, Maine, practicing at Midcoast Chiropractic Neurology. Thank you for joining me today.
Thank you for having me.
Of course. So, Dr. McNally, you wanted to get into the topic of concussion and domestic violence today. Is that correct?
Correct.
Yeah, and that's a topic that I feel like is rarely discussed, so I'm looking forward to the information that you have to provide and, helping those people in the situation that, could benefit from this information. So,
Yeah.
Before we dive deep into the topic, I'd like to ask you first what your background is, how you got into it, and why are you so passionate about what you do?
So I am a 2006 graduate of St. Anselm College in New Hampshire, and then I went to chiropractic school down in Florida and graduated there in 2010. And during my time in chiro school, I started in the neurology program with the Carrick Institute. Got into that because I really wanted to understand the breadth and depth of how chiropractic and that type of therapeutic approach could affect the brain and nervous system. And it was for personal reasons, because my Nana had a miracle turnaround cardiology wise, and her cardiologist was astounded, but she had started to see the chiropractor. Chiropractor, though, couldn't explain to me how that had helped her in the best way that I was looking for, and then that's what led me into the neurology field to understand the neurophysiology that had occurred. So that was kind of what really drove me into that into the neuro field, and it's definitely where I'm meant to be. I have a diplomate from the American Neurology Board, and I have fellowships in childhood developmental disorders, brain injury and rehabilitation, and vestibular rehabilitation.
Okay, very exciting. And now you practice out in Maine.
Yep.
Seeing mostly, what type of patients do you mostly see?
A lot of concussion patients, a lot of patients for dizziness and balance problems, movement disorders, kids with childhood developmental disorders, so varying reading difficulties, learning difficulties, motor skills problems, anything within that realm.
Excellent. Okay, so I'm curious to see how you got into the specific topip of domestic violence then. And
so I had a patient.
Sorry.
Oh, sorry. Go ahead.
No, go ahead.
So I had a patient a couple years ago who had been sent to me due to a strangulation. She was unable to eat, unable to swallow. She had been several weeks by the time she reached my office, where she hadn't been able to eat any solid foods. Her voice, of course, was severely affected. But among that was her number one complaint. And then as we started to kind of dive into things, I really started to become passionate about learning more about, of course, knowing the brain and knowing how the brain works and that, but then also understanding more about this whole new world of this domestic violence and the prevalence of it. And because of the work that I did with her, I was then asked by the advocacy group that she worked for and the DA's office to, in our local county, to do some work with them. So last year they approached me to ask if I would be interested in going and doing a training with the Department of Justice down in Texas, which I just completed in August, that focused on strangulation, and to be able to come back to Maine and to train other law enforcement professionals and advocacy groups and that throughout the state and other medical professionals on the effects of strangulation, the effects of domestic violence, and the injuries that can occur. But my biggest thing is, and something that's not talked about as much, after all the initial injuries are the long-standing and long-term repercussions that these women and men can suffer from due to the repetitive hits to the head, repetitive impacts that they've suffered over the years, or over weeks, or even from just one incident, it can happen too. So it's something people, I think, they're a little afraid to talk about, but it's such a big thing in this country, especially that I'm really passionate now about working with these groups and the people that I've been on a team with here in the state who do this every day in and day out. The police officers I'm working with and the DA and the advocates, they are just so passionate about this and they do such a wonderful job. And it's a difficult field, and these victims are suffering a lot, and a lot of the time they're really scared to come forward. And so they're trying to do the best that they can to help to kind of bring it to the surface, to help get them justice, and then also to get them the treatment that they need.
Mm-hmm. I think you brought up a lot of good points that I want to dive into, and I'm really, for one, happy that you are working in this field because, like you said, it doesn't get talked about enough. And hopefully by the end of this episode, more people will be aware and more willing and more, I guess, empowered to get involved and help out in this particular field of concussion and injury. What is the prevalence of, I guess, domestic violence and concussion, or TBI and domestic violence in America?
So the Ohio State University actually just concluded the most recent study, and it's kind of one of the first of its kind to really kind of dive in. They did it with one of the domestic violence groups in Ohio. That study came out in July, so this was kind of like the big aha moment in a way. I mean, there was research done before, but this was one that actually really brought this to the surface because they looked at specifically at the TBI component and the brain injury and the number of impacts. And they found that 81% of victims of domestic violence had suffered some type of a head injury.
Wow.
Yeah.
That's a ton. And from that 81%, do you know how many actually went to seek treatment? Or
from what I recall from the study, it was actually that was 81% of those who they were able to actually kind of bring on into the study, who were able to admit or knew that they had some type of an injury. So the numbers are probably a lot higher.
Probably a lot higher, yeah.
I mean, 81%, that is huge.
That is huge. That is huge. So a lot of people think about, you had mentioned before, repetitive head injuries over a period of time. A lot of times these aren't isolated incidences. These are,
right.
Years of trauma, unfortunately. And oftentimes, when people think of CTE or, just chronic head injuries, they think football, hockey, whatever.
Right.
Do you see this in this realm as well?
Yes. Yep. They do. Unfortunately, though, the numbers that they've been able to, the big studies are all on these NFL players and NHL players and that too. And that's just because there's more, it's talked about a lot more. It's getting to the point now that they're starting to talk about it a lot more. And over the last couple of years, I think that if there had been more, or I should say, kind of people were a lot more open about the domestic violence component, and that there'd probably be some major studies would have gone on over the years prior to this. But 100% CTE, it's not isolated to athletes. It's not isolated to certain types of head impacts. It's isolated to, it's not, well, I shouldn't say isolated. It's, it occurs in anyone who's ever suffered repetitive small or, moderate head injuries.
Mm-hmm. And I mean, these cases, do you have a number or an amount of time that people on average go through these, I guess, domestic violence bouts before they're able to seek care or before they're able to get out of that situation?
The numbers on that, I don't really have specifically for those numbers right now. But I do, there are numbers for sure that reflect the fact that the risk of strangulation increases with these, with any type of domestic violence situation. And that, which then means, or I should say, which then means that the incidence of greater, even greater damage to the brain can occur because of hypoxic or anoxic, which is loss of or deprivation of oxygen, or loss of oxygen and loss of blood flow to the brain. So while I don't have specific numbers on that right now, and I'm not saying that there aren't numbers, I just don't personally have them at the moment, that it's still,
Yeah. So when a patient like this, you said you work with patients like these, comes into your office, how do you approach that from like what does your treatment approach look like, and maybe your exam approach look like, maybe in general, and then also for these particular cases?
So in general, I evaluate everyone and I look at the entire nervous system. So I look at how the body, like different parts of the body, all interact with one another, how different functions are working, from motor to sensory, how their reflexes are, how their cognition is looking, mental tasking, all of these different areas, looking at those through the physical exam, and then also through video oculography testing, which is looking at eye movements, and balance testing on the CAP system that I have as well. So comparing, how does the brain do with certain functions versus others? How does the right side do compared to the left side? All of those pieces, and it's like a big puzzle, and you put it all together in order to ascertain what areas, what pathways of the brain central nervous system are being affected, or are affecting and creating the patient's symptoms. And then in terms of victims of domestic violence, and that you definitely have to have a level of compassion. I think that's a big thing. And I think, and every doctor has to have compassion, but there's also, you need to be very cautious, and you really need to work with the patients, because a lot of the time they are, it's difficult for them to have to be in close proximity when they've suffered some of these injuries. So walking them through everything that I'm doing, looking also as well, depending on timeline, in terms of when the last assault or injury occurred, looking at what type of imaging that they have had. If they have not had it, of course, always, in any case, always want to get imaging if I need to, but especially in these cases, especially if it's been someone who was strangled, because up to 2 years out, they still have a risk of suffering from a dissection of the carotid artery. So you always want to make sure that something like that with CTA is done, to make sure that, that they're not still suffering symptoms of that, because that's been documented out there that up to 2 years following an incident that can happen too. So these cases are, they are great to work with to help these victims regain their lives that they unfortunately lost to another person's hands in a lot of ways, but they can get it back, and they are so determined to, which is huge.
Mm-hmm. And how much co-management are you doing with other providers, like psychologists or anyone else, any other therapists?
Yeah, so I'm always a huge proponent, and I always want to make sure that patients are kind of getting, their care is being approached from every angle that it needs to be. So I always will work with any other type of specialist, whether it's an ENT, if there's any damage to the nasal passages, or or inner ear, something outside of what I handle, working with, if they are also seeing a medical neurologist, working with them, definitely. I think that the psychological component is a big one too. That for sure is. I mean, there's so much trauma that happens with this emotionally and psychologically too, that yes, you can work with it from the functional neurology perspective, but you can't address it in the same way. And it needs to be an all-encompassing type of a treatment in order to really help these individuals.
Absolutely. What are some organizations that maybe you're involved with or otherwise that are really looking to help these individuals?
So the Alliance for Hope is a big one, and they are based out in California. But they're the group that really set up, and the Strangulation Training Institute is what they've set up now, which is actually where they go and they train throughout the country. But they are the kind of big group that has gotten that Department of Justice grant for all of this training, for all of this research in that too. Locally here in Maine, I am working with a group called Through These Doors in Cumberland County, Maine, which is the advocacy group. So they work very closely with the police departments in the county, and the sheriff's department, and the DA's office as well. So, and there are several different states have different groups, like by name in that, but they are definitely throughout the country. They are everywhere, and I think there needs to be even more, to be honest, too.
Yeah.
Wish there was, but
Yeah. And what are some of the primary goals of some of these organizations that they're trying to achieve? Trying to achieve more awareness, more research, helping women to kind of share their stories or seek help.
So all of the above. So what I was really impressed with was down in Texas at the location where the training that I went to was actually held, was at a place called One Safe Place. This is in Fort Worth, Texas, and it was incredible. It was this building that had been built specifically for this reason. Half of the building is where the Fort Worth Police Department's domestic violence unit is housed. It's where their the advocacy group that works there is housed there. They have rooms for medical exams. So I was actually asked when I was down there to just kind of consult on 2 different cases that actually happened to be there, to see one of the doctors who is one of the medical professionals kind of known throughout the country for this. And he asked me to just consult on 2 cases, and it was really neat because I was able to go in, and they have these little mini exam rooms, and they so everything can be done there. They can bring in forensic nurses there, and that place was really impressive because they also have they have a daycare for if it's parents coming in, and because a lot of the time there's situations where these victims don't want to leave their kids behind, just to go to the police station. So at this location, they can go and talk to the police, and their kids can be in this little daycare. They can drop them off there for, however long that they need to. And they have a store there to help these women to get, clothing and supplies that they need. It was really just such an impressive place. And I think that was definitely, so that kind of just goes to show kind of where a lot of these groups are going toward, is to be able to provide support, not just for someone in the moment, like at the time of an incident occurring or during a legal case. It's to help them to get back on their feet, and to provide them with all the resources for like long-term, so that they can, get their lives back. And with the Alliance for Hope, their big initiative was number one. I think it was the research component for helping to establish better laws for the offenders, and then also to be able to start to increase awareness of this throughout the country. But they are doing a lot of other things. They have a camp for kids who have grown up in homes like where there's been domestic violence and that too. So they're kind of really branching out and supporting from every angle now, which I think is huge. So I wouldn't really put them in any one specific category. It's research, it's support, it's at the time like directly following incidents and support during legal cases and that. But then it's also they're working toward more support for long term too. But I think that for me, and I did bring up when I was down there, was that I feel like a big focus needs to also start to shift even more toward the long-term effects in terms of like brain function and that can occur because of these injuries. And they were really interested about that and everything too. So I need to get back in touch with them because I would love to help to start to ideally eventually maybe help them to start to branch out in that direction even more too, to be looking at a lot more of that.
Yeah, and this is, I mean, by the numbers you provided earlier, this is such a widespread and, prevalent thing that we're dealing with in the country as well as across the world. And I don't think that a lot of people are reaching out to these particular people and
Right.
offering the brain rehabilitation services that we provide. And so I think that's great, and that's a great that you're doing that. I think that's phenomenal.
Thanks.
um, what are some of the roadblocks that you've seen for these domestic violence cases, um, that get in the way of them either seeking care or seeking other types of help? And what would you tell them, someone who may be listening that's going through that, to help them make that leap?
I think the biggest roadblock is that there's a fear component and a justified fear component. There is a huge element of emotional and psychological abuse that occurs in these cases. It's not just physical, and I think that that's the biggest piece. Also, there's a huge piece that with a lot of these cases, and especially strangulation cases, it's felt that, or the common thought is, well, how can they not remember? They can't remember a lot of the time because of the fact that loss of oxygen to the brain first affects two areas that are really important. One of them being the one for memory, the hippocampus. It's one of the most susceptible areas to the brain. And so if you if you've lost consciousness ever, if you've just had any, head injuries anyway because of the shearing forces. But my big thing when I'm talking here is right now about this whole, if you lose oxygen supply and blood supply to your brain and that hippocampal area gets damaged. And then also your cerebellum is another very susceptible area, which is a big one for balance and coordination, tons of other functions, but those are two of the big ones, as we know that are kind of most commonly known about that. And then also parts of the basal ganglia also are very susceptible to this loss of oxygen. And so, but I think that the number one that usually stands out right away is that, well, I can't remember, or I don't recall what happened. And usually those are indicators that someone has lost consciousness and has had significant loss of blood flow and oxygen to their brain. And so that's not a reason to back down and to shy away, because the whole purpose for this group training with the Strangulation Institute is to start to improve for police departments and for the DA and advocacy groups so that they can support these victims without the victim having to ever appear in a courtroom, to be able to support a case to that degree. And so I just want to say to anyone out there who may have suffered from any type of domestic violence, and not just strangulation, but any form at all, be it emotional, psychological, physical, that there's resources out there, and they're there to help you. And it is going to be worth it in the end, because you're going to get your life back, because these people are trained to do this, and they're trained to help to bring to justice the individuals who have done you wrong, and who have harmed others. And because it's not an isolated incident, and the numbers are astounding in terms of the rate of repeat offenders, but then also the progression for offenders too, from the type of injuries that they're inflicting to the type they can inflict in the long run. And so if, there's resources out there and there's people that want to help and to help to lead you down the right path so that you can be free of this.
Absolutely. Very well said. Very well said. As a provider, what are some things that tip you off or that you're on the lookout for in suspected cases of domestic violence?
Yeah, so for me, always just looking to see. A lot of the time, it will be a case where someone might come in and they're kind of like, well, yeah, I've had a lot of head hits and that, but they won't if you ask them for, okay, so like what's happened? Do you recall what's happened or how they happened in that? They don't really want to say it. So sometimes that might flag me a little bit. In a more acute case, of course, I might be looking for external indicators, external signs, but it's actually not super often that you see any bruising or any petechia, which is the discoloration from the blood vessels, and that's actually really rare. And people normally think, well, you have to see these physical signs in that, but when you start to talk to someone and you start to find that they are having problems with memory, with their balance, with their vision, with, they might be having dizziness. They might be having problems when they go to stand up from laying down or sitting to standing in that too. And just trying to talk to them if there's any suspicion, if they're giving me any indicators. And it's hard to really say what are indicators, because every situation can be different. But a lot of the time they might tell me that, well, I don't really want that in my medical record. And right there is a flag for me too, to kind of delve in a little bit more into that and just kind of discuss with them, about the fact that this all completely private, but that in order to help them that we need to try to talk about it a little bit more. And then if it's a situation where they, of course, and that's talking about a situation where they haven't been referred to me because of this specifically. And so if it's one where I think that, that they should get some assistance in other areas, advocacy groups and all that too, then I will definitely provide them with the information to do so, for sure.
Great. Very good. So we are nearing the end of our time. So I just wanted to make sure I gave you an opportunity to leave us with any final thoughts that you may have on this topic.
So I just think that, people need to realize that this is happening around them, and it's happening to people that they normally, quote unquote, wouldn't suspect. It doesn't matter someone's race. It doesn't matter someone's financial standing, anything like that. These victims are victims, and it is so prevalent that one in four people have suffered some type of domestic violence, which is a staggering number when you really think about it. Mm-hmm. And I think it's important to know that if you start to see signs of any type of emotional, physical, psychological abuse in someone that or in your own relationship, that you try to seek the help that you can get. And it, whether it's a physician, or it's the police department, a friend, anyone who's going to be able to help to kind of steer you in the direction, to get the help that you need. Because like I said, these aren't one-time incidences, and these repeated, hits and that can create long-term changes for you. And if it's something that we're going to be able to help with, functional neurology, then we're going to do it. And if someone comes to me and it's like a situation that I can't help, I'm going to refer them out to the provider that's going to be able to help them the best. and I'm not going to stop until I find that person. Because I think it's just so, and I do that for any patient, but especially in these cases, because a lot of the time it's such a long time before these victims come forward. So just be on the lookout, know that it's a lot more prevalent than you ever realize, and that it's okay to talk about it, because it's not something that ever should be kept in the dark. It's something that really needs to come to the forefront now, especially with all the research on CTE and concussion and TBI and that, with athletes and that. I think we really need to step up our game with research for domestic violence cases.
I agree. Absolutely. It's such a untapped area that is obviously so prevalent. 1 in 4. That's way more than the amount of football players in the world. So.
Yep. Yeah, that's a good way to put it.
Yeah. So, and you are a great resource and a great provider, especially to concussion cases and especially these domestic violence cases. So, how would somebody find out more about you, your services that you provide, as well as the other organizations that you're involved with, and maybe any other resources, again, that would be helpful?
Yeah, so for me, it's Midcoast Chiropractic Neurology in Brunswick, Maine. And my website is www.midcoastbrain.com. I also have a Facebook page and an Instagram page, and it's at Midcoast Brain, is the name. And as far as Alliance for Hope, they have a website. I believe it's allianceforhope.com. And then Through These Doors is the other group that is here in Maine specifically. They are fantastic. And Through These Doors, they have a Facebook page that's also accessible, and they do have a website as well.
Okay, very good. Well, I want to thank you for coming on and sharing this information with us. I know a lot of people are obviously going to benefit from this, and hopefully someone listening will, this episode will resonate with them and they'll seek the care that they need. So thank you for that. I think this is probably one of the most important episodes that we've ever done. So,
Oh, thanks. Good.
so
Glad.
this topic is, like we said, we've talked about very little, and I'm glad that we were able to do that today.
Great.
So.
Thank you for having me. I'm glad. Yeah, I'm really happy to have been able to talk about it, because we need to get it out there more.
Absolutely. Absolutely. Well, thank you again. And this has been your host, Dr. Coppus, signing off. Be well.